Thank you and good afternoon, everyone. I hope you're all enjoying your day here at the Expo. And today, we'll be having a look at some major causes of injury. We'll be having a look around the home, having a look at a few of the major hazards, and having a look at some simple ways that we can prevent these injuries from occurring. We'll also have just a little bit of a brief intro into child injury itself, but I won't bore you with too many of the statistics. We've got a couple here, and this just does show, this is Victorian statistics, how many child injuries do occur every year. So as you can see, it's a little bit hard, but over 14,000 children are admitted to hospital due to an injury, and over 67,000 present to emergency departments at hospitals. Many more are seen by local nurses and GPs and those sorts of things. But the important thing to note with these are preventable injuries. So there was something that could be done to prevent the injury from happening or to reduce the severity of injury as well. And we'll be having a look at the home today. That's because, as you can see from the chart there, the home is the most common location where children are injured. It does make sense that children, especially very young children, the home is where they spend the majority of their time. And that's why it's so important that we can make our homes as safe as we possibly can for our children. And when we're thinking about childproofing our home, it can be a very difficult task. As I'm sure you all know, children grow and develop very quickly. So from the beginning, when they can just wriggle and kick, it doesn't take long before they start to crawl, before they start to move around, they start to walk. And as they go up all the stages, their access to hazards becomes greater. So we do have a really handy home safety checklist, which goes through all of the hazards in the home. And something we say is it's best if you can think about childproofing your home from an overall perspective. So if you have very young children who are only at the wriggling stage, if you can think as far ahead as possible. So while they won't be running up and down the stairs and getting into the cupboards yet, if you can do everything at once, it just really does reduce the risk of you being caught out and caught unaware. That is a common scenario when injuries happen, is that the parents are caught unaware, they didn't know their child could reach that high or that they could climb up onto that chair and those sorts of things. So as far ahead as possible is best. And when we're talking about making your home kid-safe or child-safe, we do say there's 3 steps. And the first one is to spot the hazard, and that's where the home safety checklist is really handy. It does contain, it's double-sided, it contains a lot of things we often overlook or don't think of as well. So the first step is to spot the hazard. The second one's deciding how to deal with the hazard. So that could be, for example, if you've got dangerous substances in a drawer, it could be putting a lock on the drawer. Or it could be if you've got a poisonous plant, is removing that plant out of the garden. So it could be protecting against it or taking the hazard away totally. And the third one is to make the changes. So children aren't safe until we make the changes. So it's important once we've decided how to deal with the hazards that we make the changes straight away to ensure that children are safe. We'll go through and start to have a look at a few major causes of injury, a few major areas in the home. It is a lot of information, so please don't feel overwhelmed. If you haven't already, our stand's down at B47, and we have a whole range of fact sheets which refer back to all of these things and the home safety checklist as well. So falls are the major cause of injury for children, and the fall usually depends on the child's age. So for very young children, we see a lot of falls from nursery furniture, so from prams, from cots, from change tables and those sorts of things. And with a little bit older children, we start to see more falls when they go outside from bikes, playground equipment, when they become more active. But for very young children, a lot of those products do come with a harness in them. So you notice your pram, your high chair, all those ones. And we do say it's very important to use that harness to make sure it's secured properly. It really does greatly reduce the risk of children falling. Change tables are a particularly dangerous one because they are up at a height. And it doesn't take much for a child to be able to roll off of those. So we do say if you are using a change table to always have one hand on the child at all times. And it helps if you've got everything close by, so everything you need, the nappies, everything close by so that you don't have to turn away for a moment. If it is practical, and it's not always practical, but it can be safer to change children on the floor, particularly if they're rolling around a lot. Then when they do roll, they're just going to roll around on the ground and not off of something and have a fall. Prams are an interesting one as well. They can tip and roll away very easily. So we always say try not to hang anything off the handles of the pram. When it gets too heavy on there, it can tip them backwards. And to be careful how much is placed in the compartments underneath the pram as well. If that's a bit too heavy, that can make them unstable. And to always make sure the brakes are put on. And the tether strap's a really good idea, the one that comes on the handle of the pram, to have that around your wrist. And it just does mean that you are connected to the pram if you have another child or you're holding shopping or those sorts of things, and reduces the risk of it rolling away. Now, poisons are another one that we all have in our homes. And often when we think of poisons, we think of the dishwashing detergents, we think of the bleaches and those sorts of things. But there is actually a more common cause in very young children, and that's our everyday paracetamol is one of the number one causes of child poisoning. And that's probably because it's something we often don't think is dangerous. So the bleach we might put away straight after use, but the paracetamol we carry it around in our bags, we have it in nappy bags. It's probably something we might leave out after it's been used. So it is important to note that medications as well as our household cleaners can be poisonous for children. Particularly the medications, children often see them as lollies, so that's why they usually like to get into them as well. But our number one tip with poisons is to always have them up high, out of reach of children. So preferably if you've got sinks above the, cupboards above the sink or above the stove, to store your medications and your cleaning agents up there. But I know that dishwashing liquid's often one we do store under the sink for convenience. It's a lot easier. So we definitely say if you are storing them underneath the sink to have a lock on the cupboard to restrict children's access in and out of there. And a lot of the products, the bleaches, those sorts of things, do have the child-resistant caps on them these days. But the important thing to note with those is they're not child-proof. So they're made to be hard for children to get into, but not impossible. And a common scenario we do see is children, they put everything in their mouths. So they usually put the cap straight into their mouth. As soon as they bite down on it, that defeats the locking mechanism and it's open within a few seconds. So those lids can help restrict children's access, but it's still important those products are up high, out of reach. We'll just quickly touch on poisonous plants. When children start to move outside a little bit more, there are some plants that can be poisonous for children. And like I said, again, children do explore by putting everything in their mouths. So usually when they go outside, the red berries, those sorts of things, the plants go straight into their mouths. We do have a list on our website of some plants that are potentially poisonous for children. And it's often a good idea to discuss with your local nursery if you're putting in new plants about ones that are child-friendly. So if they do go out there and they do put them in their mouths, it's not going to be an issue. But some of these range from something mild where they might get a little skin rash, and some are more severe poisoning cases. Burns and scalds is another major cause of injury that we see. And the important thing to note is that at 60 degrees, it takes 1 second to cause a full thickness scald. But at 50 degrees, the water, it takes 5 minutes to cause the same injury. So while it doesn't seem like a big drop in temperature, if you think about 1 second versus 5 minutes under the water, it does have a big impact. And all new homes have to have the hot water temperature set at 50 degrees in bathroom outlets, the delivery temperature. But if you're living in a home that was built, or you're renting a home that was built before about 1990, the temperature could be set anywhere from 60 to 75 degrees. So it is a really good idea to have a licensed plumber come in and check that, and they can turn that down at the bathroom outlets. And it's usually said the bathroom outlets because that's where children have the most access to water. We often need hotter water in the kitchen and other areas for sanitation purposes. It's a really good idea with bath water as well to test with a thermometer if you have one. Our skin's a lot thicker than children, so something that feels just warm to us could be far too hot for them. So the recommended temperature, the maximum for a child's bath is 38 degrees. And it's a really good idea to test that with a thermometer if you have one. We often see some burns and scalds when children get more active from hot tea and coffee as well. So we always say to try and keep those up, out of reach of children. And if they're on tables, try and have them towards the centre of the table, particularly when children start to climb. The edge of the table is the first thing they go to grab onto as well. So it's a good idea to have those up, out of their reach. Hot food can also be another one. So things like soups and 2-minute noodles we usually see a lot during winter. If children are sitting there on their laps watching the television, a lot of those spilt onto their stomachs and legs. So it's important to be careful with hot foods as well. Now with water safety, and when we think about water safety, we usually think about pools and spas and the beach and all the big bodies of water. But for toddlers, it's really anything that can hold a few centimetres, about 5 centimetres of water, can pose a drowning hazard for them. So it's really anything that they could fall into that could just cover their mouth is enough to pose a drowning hazard. So that includes things such as baths, buckets out in the backyard that might have water in them, even the blow-up toddler pools or the shell ones, the plastic ones that have sand in one half, water in the other. Even pets' drinking bowls, eskies with melted ice, can all pose a drowning hazard for very young children. So one of the major recommendations is active adult supervision around water, and that's generally said for children under 5 for the adult to be there within arm's reach at all times. So if something does go wrong, you're right beside them to help them. And for children over 5, it's usually said to have an adult in the immediate area. So being inside the pool fence if they're swimming in the pool, being near them at the beach and those sorts of things. And I'm not sure if any of you have seen those 20-second ads have been on television as well. So that's the other thing with child drowning. It's usually very quick. And it's usually something we often expect to hear a lot of splashing, a lot of crying, calling out, but it's often silent as well if children do fall into a body of water. So you often don't hear anything, and it happens very quickly, which is why it's so dangerous. Now, I'll quickly touch on toy safety. I know that the ACCC have a talk coming up later on this afternoon, and they're going to touch on a few product safety issues. But toys are something children use every day, so it's important that they are safe for them to use. So as you can see in the picture there are warning labels and age restrictions on a lot of toys. So it's important to take note of those. They're for things such as small parts or long strings that may be a hazard for a child. And an increasing one we are seeing, and the ACCC will be talking about this as well, is button batteries posing a danger. These don't just come in children's toys, but they also come in a lot of other things. Probably one of the other most dangerous is those singing greeting cards, the ones that sing to you when you open them up. They've usually got a couple of those button batteries in there, and if children get into those and they're often shiny again, they swallow them. They can cause some quite severe internal burn injuries as well. So it's another thing to be wary of. A lot of the toys these days do require a screwdriver to get in and out with the batteries, which is really good, but making sure that's secure every time and that the dead batteries are thrown away straight away as well. Down in the bottom right-hand corner, the baby walkers, there is some caution recommended with using those. We do see a lot of fall injuries, trips from changes in level, downstairs and those sorts of things. And there's also some developmental concerns with those, so they're not recommended to be used for more than about 10 minutes at a time, just because they do have children sitting in a funny position when they're in there. The development experts would much rather them to be playing on the ground, having that time to develop their muscles that way. And one of the last topics we'll touch on is pet safety. And pets are a great idea for children, whether it's a cat or a dog. They're great for children to grow up with. It gives them that sense of responsibility and learning. But it is important that we make sure our children are safe around our pets as well. And I know that the Responsible Pet Ownership Program have a stand here. They have some great information on pets and children. So I'd recommend you go past there if you haven't already and pick up some of their brochures. But generally we say it's to separate children and pets during feeding and sleeping times. That goes both ways, so when the child's feeding and sleeping and when the pet's feeding and sleeping as well. They've been shown to be the two most common times when children are injured by pets. And children are usually injured by a dog that is known to them as well. So it's less common it's the strange dog down at the park or in the street. And that's probably because we are more familiar with our pets, so we probably don't take as much care from sometimes. We think we know their temperament, they won't bite, and those sorts of things. So it is important to be cautious with our own pets as well as the strange ones as well. So to wrap up, our major take-home messages, we always say as children grow, it's a good idea to role model appropriate behaviours. So things like us wearing our seatbelts, crossing the road at the right spots, set a really good example for children and teach them the safe practices. And of course, supervision is the number one in preventing injuries. There are a lot of safety products out there which are great, your stair gates, your cupboard locks, but we can't rely on those on their own. So it always have to be used in combination with active adult supervision, and that's the best method to keep our children safe. As I mentioned before, being aware that children's development does happen so quickly, so being aware that it won't be long before they're crawling, then walking, and accessing all those new hazards. So thinking as far ahead as possible is really great. It's also a really good idea for one or even more family members to have some basic first aid or CPR knowledge, just so hopefully you'd never need to use it, but in the event that there is an accident, you do have that basic knowledge of what to do. And there are a number of first aid courses out there that are designed specifically for parents and focus on children's issues as well, so they're great ones to have a look into. And the last one there is to have your emergency contacts on hand. Back at our stand, we do have some of these magnets for the fridge with the emergency numbers, but it's also a really good idea to punch a lot of these into your mobile phones, because we might be out and about and not at home if something does happen. So it's good to have those there, handy, ready to go. As I mentioned, we're back down the other end in B47. If anyone's got any questions, you can feel free to come up and ask me after this. Otherwise, come and visit us over there for all of our home safety information. We've also got a lot of child restraint information over at our stand as well, and a few other bits and pieces. So feel free to come over and visit us. Thank you.